Now, in the same breath, Health Permanent Secretary SUsan Mochache has urged Kenyans to prepare for the worst as the coronavirus pandemic continues to ravage the country. The PS says Kenyans should embrace the current COVID-19 protective measures that are likely to persist for several years. Addressing the media after inspecting the construction of Mathare Nyayo Hospital here in Nairobi, the PS, accompanied by Nairobi County Woman Representative Esther Passaris, said as government, they are determined to combat the virus that has so far infected more than 4,000 Kenyans.
A matter of fact to all of us that COVID is here with us to stay. We should not think that COVID will go away in another 1 month or 2 months. I think what lessons we need to start drawing and the realities we have to start facing is that even as we move ahead and restrictions are eased, life will go on with COVID. And so coming to a site like this and finding people still working, people still earning their livelihood, but making sure that the necessary precautions are taken up is important. People are wearing masks and of course their usual protective gear. But I think wearing masks and the fact that I have seen sanitizers at different points within this construction site is a demonstration of what our lives will be like. People will continue to sanitize, people will continue washing hands, and we will continue to wear masks. COVID will be here, but life will simply have to go on. We will have to get used to what the Cabinet Secretary of Health always tells us. We will have to get used to the new normal.
What we need is to look for money. And the only way we're going to be able to meet the targets of opening this hospital is if we find money. So the health budget has about over 100 billion. If there is a way that we can find to reallocate, do some reallocations, to actually complete this hospital. Because when we were driving through here, the PS has seen the population that this hospital would serve is massive. We've got a huge population in this area and we need a hospital in this area. So I think the journey began a long time ago. What we need now is to put our heads together, get the resources, because obviously we've got a contractor that has been here from 2012. The contractor also, it costs the government a lot of money when a contractor is on site for a very long period, and that's wastage. So we have to look at what can we stop so that we can actually get this one going. And under MESS, I think we have a lot of equipment that we bought under MESS and we're on the second phase. So trying to equip it with the equipment, there must be some equipment lying around that we're not using. So there will be also a way to get this hospital going. And I believe that when we have the PS here, we have the entire Ministry of Health represented here. And when we have Public Works here, we have the people that are implementing the project. The contractor is also here. So for the people of this constituency and the neighboring constituencies, I think it will be an absolute blessing and it will be the way to deliver universal healthcare. So the President's agenda is universal healthcare. So we have to focus on ensuring that we have more facilities.